So you've heard a little bit about PERFORM2Scale from Susan in the first presentation. I'm going to tell you a bit more about it. So just firstly, these are my colleagues, some of whom are in the room today as well. So a little bit about the background. Having an adequate and well-performing workforce is critical to achieving universal health coverage, and performance can be improved more effectively at levels closer to the frontline workers. And it's important to invest in health managers who manage, supervise and support the frontline workers. District-level health managers or district health management teams in decentralised contexts are well positioned as they are close to the providers and to the problems and know what they can achieve within their available resources. So the PERFORM project, which is the pilot to PERFORM2Scale, developed a problem-based management strengthening intervention for management teams at district levels in 3 African countries to improve both health workforce performance and service delivery more generally. It was evaluated and it showed it was effective in enabling the management teams to both solve workforce performance and other problems locally and to become better managers, and to have a wider impact and thus contribute to the achievement of universal health coverage. The PERFORM management strengthening intervention is being scaled up. So, PERFORM2Scale, or P2S as we call, it's funded by Horizon 2020, is conducted in Ghana, Malawi and Uganda over a 5-year time period, and we're in year 2 at the moment, with the aim to develop and evaluate a sustainable approach to scaling up a district-level management strengthening intervention in different and changing contexts. So let me briefly first tell you about the management strengthening intervention. So it's using an action research approach, and the research team worked with the district health management teams to go through this process. So the first thing was initial engagement with the DHMTs to explain the whole process. They went on then to do a situation analysis of the district and identify workforce problems and service delivery problems. They then went into a workshop where the 3 districts came together to do an in-depth analysis of those problems, to really find out the root causes of those. So here they are doing a problem tree. They did further problem analysis in the district because not all the DHMT members were able to go to that, and maybe to collect even more data to quantify and qualify those problems. They then have another management workshop to develop strategies to solve those problems and develop a work plan. So here we are with an objective tree next to a problem tree analysis. So they go on to implement or act those strategies out, and then go on to observe and reflect, so monitor the effects of those strategies, and thinking, to reflect on what worked well, what didn't work well, what to change at that point, and documented this through reflective diaries and through discussions with the research team and inter-district meetings. So these workshops and meetings were a space to create a space to think through the problems and find solutions as a team away from the daily work and distractions of normal work. And it's also to share learning and knowledge across the 3 contexts, as well as creating a bit of healthy competition between the districts. And around we go again. We don't just do one cycle, we keep going round and round, maybe changing those strategies or picking another problem to address. So that's the MSI, and we're now scaling this up. So we've developed a framework based on the ExpandNet framework to do the scale-up process. And I'm just going to talk you through some of these areas. So the first one is the National Scale Up Steering Group. So the purpose is to steer or oversee the scale up process with it during the project and importantly beyond the project. So the ultimate aim is for them to take on this intervention and widen its implementation across the country. So they develop an initial country-specific plan for scale-up. They adapt it, taking learning from the process. They identify the districts. They identify members of the resource team. So then the resource team is the group that actually implement the management strengthening intervention. They facilitate it with the district health management teams. So at the start of the project, the research teams work very closely with this resource team to actually implement the scale up of the MSI and slowly take a back seat. I've talked about the management strengthening intervention. So vertical scale up. So this is by setting up and supporting these structures. We plan to institutionalise this MSI and its scale up through policy, political, legal, budgetary, and different changes to include, so that they're included in policy and guidelines documents, and in particular to support the horizontal scale up. This requires stakeholder engagement. And then the other one is the horizontal scale up, so the expansion of the intervention across the country. So in the PERFORM2Scale, we will implement the management strengthening in a district group. So 3 districts come together that are close to each other. And we do the MSI in that setting, and then move to another district group, and then to another, and then to another. And this is our initial ambitious plan for scale up, so that we would end up with doing like 12 different districts in each country, working with them, and 30 cycles. But we'll see where we get to. And of course, this scale up isn't happening in a vacuum. There's the environment. What's going on there? What's happening in terms of policy changes, environmental changes. So we need to look at that and keep a close eye on that. So we're doing process evaluation. We've got lots of methods about that to be really researching this process of scale up, as well as the outcome evaluation as well. Just very quickly, this is the theory of change for the project, showing the different pathways to what we're trying to do. But the main thing that we want to do is we envisage the health policies and plans include the management strengthening intervention, that national and regional resource allocation and scale up infrastructure support the existing MSI and ongoing scale up, and that the MSI is embedded in district health management team working methods without external inputs. So, lessons so far. 4 key ones. Okay, and I'm going to talk you through those quite quickly. So the first one is stakeholder engagement is key. There was a time gap of 2 years between PERFORM and PERFORM2Scale in Ghana and Uganda. And this has resulted in a bit of loss of momentum and some memory loss about PERFORM. And this was because of a gap in funding. And this really stresses the importance of beginning with the end in mind. So when you start a pilot, to actually think, how are we going to be scaling this up? We did a stakeholder analysis at the start and developed stakeholder engagement plans to have meetings and brief people about the project. It was challenging, getting time for meetings with key people who have competing commitments. We're working in the crowded arena of development partners and the incentives of other programs. We recognise that we still have got more work to do to convince stakeholders of the value of the MSI. They probably need to see the results with their own DHMTs rather than just hear and read about it. At the same time, we're discussing in more detail about the resource implications of scale up of the MSI, and this is continuing through national workshops with stakeholders and opportunistic as well as planned meetings. Also the importance of presenting evidence in a way that engages and resonates with the stakeholders. In Uganda and Ghana, the country team facilitated a meeting where the DHMTs from the PERFORM projects talked about the experiences of PERFORM with national stakeholders, and this worked well to get support for the scale-up. But also the importance of stakeholder engagement at the district level, not just with the health side, but the administrative wing, the political leaders and the council members, the ones who are making the decisions or influencing strongly those decisions. The second lesson is about establishing this national scale-up steering group. It's taken time to establish these groups in each country. It's been a bit quicker in Ghana, probably because the scale-up is happening at the regional level, in the region where PERFORM worked before, and there are existing relationships there between the research team and the regional health management team. In Malawi, it's taken time to work out where PERFORM2Scale should sit. They've moved from the Ministry of Health to the Ministry of Local Governance and back to the Ministry of Health. So it's kind of that complex, kind of messy business of that. In Uganda, one of the district health officers in PERFORM is now in the Ministry of Health. So he was able to instigate the development of the steering group. So opportunistic as well, really. And the process of longer term planning after, is in process at the moment. So by the end of the year, we've established these groups and we've started facilitating MSI in those districts. But the longer term planning is coming next after they've learned the lessons from the first MSI cycle. The third lesson is flexibly using the toolkit. We developed a toolkit for the scale-up and the MSI facilitation, including programs, policy guidelines, guidelines for facilitating a problem analysis, something like that. And we did this to support a similar approach across the 3 countries, as we want to research the whole process of scale-up. But in each place, adaptations are being made. For example, the timing of a national workshop was meant to be before the MSI, but because they wanted to see the results from that, they've left it until after that, which is important because then they will hear directly from the district health management teams about the value of the management strengthening intervention. Joint planning and facilitation of the MSI in each of the districts. So this is working, so the research team works with the resource team to facilitate it in the district. So working side by side in the planning and implementation of that. And that's particularly worked well in all settings, but in Ghana, it was really interesting that the resource team were there listening to different problems, things that they didn't know about. So they take that back to their normal job. Finally, is the importance of ongoing learning. As you can see, the process of scale-up is evolving as we go on, and it's important to capture that learning about how it's being scaled up and why. And we're doing this in several different ways. Frequent interactions with the district health management teams, national workshops with the stakeholders to listen to what they have to say about the scale-up process. And all this is coming together for us to be able to learn about what to change in our scale-up process. We're learning as we're going along. Process evaluation methods, including tracking and a costing tool, reflection activities and interviews with stakeholders. And finally, to learn across the different country contexts. So we have webinars across the project, so with different project staff about different areas of it, project management committee meetings and workshops. So these are our lessons so far after year 2. See you in Dubai for an update.